working to connect a region of over 600 million bridges between our lands.
Hello and welcome to ASEAN in Focus. I'm Alma Angeles on today's headlines. Malaysia's COVID-19 death toll is now at 20. Thailand has barred entry into the kingdom late on Wednesday, enacting sweeping emergency powers in a bid to stem the local spread of the coronavirus outbreak. These updates and more from our EBC correspondents in the ASEAN region and other parts of the world. First up, the World Health Organization has urged wealthier countries to support the lower-income countries through the coronavirus pandemic during the daily briefing in Geneva. Dr. Michael J. Ryan, chief of the WHO Emergency Response Plan, said that these richer nations must move to protect the others. Let's listen in.
Have a whole of government approach, because this pandemic cannot be arrested by just the health sector alone. We need to have all relevant sectors working together to suppress and control this pandemic. And not only the whole government approach, we are also saying we need the trust of the community and community.
Situation for all countries in Africa, and the international community, I think, and for all countries of the South and low and middle income countries, need support. And the North must, while dealing with a massive crisis in its own regard, must move to protect the South, because nobody is safe until we are all safe.
Particular in Wuhan and in Hubei, and we know that these measures are being lifted now. And the reason that they can be lifted is because these systems are in place to actually quickly identify and isolate any cases that pop up. And now what we're seeing in China is we're not seeing cases, indigenous cases, cases that are being locally transmitted. We're seeing new importations. There are more.
All right, to Malaysia now. COVID-19 death toll there is now at 20. We have more updates from our EBC correspondent in Malaysia, Ruby Tinawin. Ruby?
Yes. Malaysia has recorded its 21st COVID-19 death after a 63-year-old Malaysian with chronic disease medical background died at 4 a.m. today. He was a participant of the Tabligh gathering at Masjid Jamek Sri Petaling last month. As of today, a total of 172 new COVID-19 cases were reported, while 199 patients have recovered, bringing the total number of cases in Malaysia to 1,796 since the start of the outbreak. Malaysia's Health Director General Noor Hisham Abdullah said initial investigation indicated that of the 172 new cases, 71 were linked to the Mosque Tabligh cluster. Meanwhile, 73 staff from the Ministry of Health here in Malaysia who were tested positive for COVID-19 contracted the virus not from handling patients, but from attending wedding events that were also participated by those who joined the Sri Petaling Muslim religious event last month. The Health Director General, Dr. Noor Hisham Abdullah, said that based on their investigation, 47 cases of the 73 cases detected were connected by a wedding event on March 6 and 7 in Bangi and Putrajaya respectively. He further added that other sources of infection were traced to a history of traveling outside the country and coming into contact with family members of COVID-19 patients. He said that 1,895 frontline ministry staff has been tested so far, and 1,187 have tested negative, while 708 cases are still pending. Dr. Noor Hisham urged all health personnel and other frontliners to alert the respective heads of departments if they had direct involvement or contact with participants who attended the Muslim gathering. A wedding ceremony held in Bangi on March 6 or a wedding ceremony held in Putrajaya on March 7. On the extension of the movement control order until April 14, he advised members of the public to continue to observe social distancing and to ensure there was a space of more than 1 meter between one another. Malaysia's Ministry of Health announced around 3,000 retired nurses have registered to come back to serve at the front line and to help contain the COVID-19 outbreak. This is in response to their plan on recalling its retired doctors and nurses to reinforce the current frontliners in the face of the COVID-19 outbreak. Health Director General Dr. Nur Hisham Abdullah said that the ministry is trying to establish the expertise of each nurse to be able to deploy them appropriately, instead in clinic or either in clinic or hospitals belonging to the health ministry. He also said they were targeting 2,000 skilled health professionals to assist as soon as possible to help also increase the manpower. At present, the health ministry now have 2,400 experienced nurses who were undergoing their post-basic training before deploying them to help in clinics and hospitals nationwide. He said that some of the Ministry of Health staff had been working non-stop for more than 3 months, and so they needed to coordinate their manpower. The Domestic Trade and Consumer Affairs Ministry said there will be no restriction on supply chains, food marketings, and e-trade throughout the period of the movement control order. Datuk Alexander Nantralinggi said this consists of food production, retail, packaging, distribution, wholesale, distribution centers, and raw materials manufacturers, which are permitted to continue operating by following set guidelines. Linggi added that companies supporting the food supply chain and defined as part of the support industry can also operate with a minimum number of workers and in compliance with COVID-19 control steps as laid down by the Ministry of Health. Malaysians are advised not to worry about the food supply and daily necessities as there had been guaranteed to be sufficient. He mentioned that it is crucial for every individual to not engage in excessive or panic buying, but instead practice sustainable consumerism and planned purchasing. A more comprehensive economic stimulus package for Malaysians will be revealed this Friday instead of March 30 as previously expected. Prime Minister Tan Sri Muhyiddin Yassin disclosed the new date after announcing the extension of the movement control order to April 14 in a special address at the midway point of the original 2-week period. He said the Finance Ministry are working tirelessly to prepare an economic stimulus package that will benefit everyone, whether you're a taxi driver, Grab driver, farmer, restaurant operator, pisang goreng seller, burger seller, or salaried employees. The government will try its very best to ensure all of you will benefit from all the packages that the government will prepare. No one will be left behind. On Monday, the Prime Minister said that he could announce a more comprehensive economic stimulus package and people's aid in light of the current COVID-19 economic situation, which has affected many. Today, the Prime Minister also urged Zakat collection centers nationwide to play a more proactive role in helping the hardcore poor, which he believed were facing tremendous hardships due to the nationwide shutdown of all non-essential activities. He also appealed to non-governmental organizations to contribute to the needy regardless of race and religion during this trying moment. Malaysia today entered the 9th day of the original 2-week restriction order introduced to contain and break the chain of COVID-19 infection. From EBC Malaysia Bureau, this is Ruby Tinawin. We live in interesting times.
Thank you, Ruby. Going now to Cambodia. 4 more COVID-19 patients made a complete recovery, bringing the total to 10. We have an update coming in. Joining us live now is Crystal Ann Ballesteros from Cambodia, EBC Cambodia Bureau. Crystal Ann Ballesteros. Ann?
Hi, Alma. As of 10 p.m. on yesterday's reported cases in Cambodia, there have been 96 cases of COVID-19, including 38 Cambodian, 36 French, 12 Malaysian, 5 British, 2 Americans, 1 Canadian, Chinese, and Belgian. No death tolls reported and 10 recovered. Good thing is the recovery brings hope that amid the increasing numbers of infections, the retroviral drugs being used to treat patients has thus been effective. Also, government malls asking the king to place the kingdom in a state of emergency. Prime Minister Hun Sen said today that the government is considering requesting King Norodom Sihamoni to place the country in a state of emergency amid the COVID-19 pandemic. But Hun Sen objected to the constitutional stipulations, saying he should be able to declare a national emergency without a consensus agreement. Whenever governments declare a state of emergency, civil rights are restricted, the Prime Minister said, adding that political observers should not accuse him of cracking down on citizens. Several nations currently have stay-at-home orders imposed, restricting citizens' movement in an effort to limit the spread of the virus. In Cambodia, as the number of confirmed cases in the country steadily climbed in the last 2 weeks, the government has ordered the temporary closure of schools and entertainment venues and banned concerts and religious gatherings, while adding beer gardens to the list of shuttered venues on Wednesday. Travel in and out of the country has also been restricted. Meanwhile, Cambodia gets ready with more than 3,000 rooms for COVID-19 patients. To be ready for any potential spike in COVID-19, the government has reserved more than 3,000 rooms for potential patients. In starting this, Prime Minister Hun Sen said more than 3,000 rooms of hotels, school buildings, dormitories, and other public buildings across the country have been arranged to receive COVID-19 patients. In Phnom Penh, there are 4 places ready for COVID-19 patients, including Kamai Soviet Friendship Hospital, Chek Angre Health Center, Priaket Mele Military Hospital, and Great Duke Hotel. The Prime Minister underlined that all patients, regardless of the nationalities tested positive for COVID-19 in Cambodia, have free of charge access to the treatment. He added that the royal government's recruitment of voluntary health practitioners this time is part of a commitment to combat the COVID-19 in the kingdom. Cell phone companies have added a health message about COVID-19 to dial tones, asking phone users to call the health ministry's hotline if they display symptoms. Local authorities have started driving through neighborhoods, playing messages about the illness through bullhorns. The Prime Minister urged people not to go out unless it was necessary, and asked the public to encourage those who might have direct contact with an infected person to get a health checkup. He also promised to provide free health care for anyone who tests positive for the respiratory illness in Cambodia. Moreover, Prime Minister urges people not to use superstitious methods in trying to ward off COVID-19. Prime Minister Hun Sen yesterday urged people not to use superstitious beliefs to try warding off the deadly COVID-19 or believe false claims that there is a drug to cure the disease. During a meeting at the Peace Palace with volunteer physicians working to fight the pandemic, Mr. Hun Sen said he had been informed recently some people have been using superstitious methods such as burning fires to eradicate the virus, noting this action is very risky. Mr. Hun Sen also warned the authorities will take legal action by seizing face masks and shutting down any pharmacies that sells the face mask for higher prices to take advantage of people who need them to protect themselves and prevent the spread of COVID-19. To sum up, the Prime Minister expresses profound thanks to the authorities at all levels for their efforts in raising public awareness on preventive measure against COVID-19 pandemic in the kingdom. For the recent updates of COVID-19 here in Cambodia, I am Crystal Ann Ballesteros, and we live in interesting times.
Thank you, Anne. We now go over to Thailand. Prime Minister General Prayut Chan-o-cha has declared a nationwide state of emergency there, and initial restrictions have been issued and is now in place. There are 357 checkpoints monitoring travelers nationwide, as Cristel Parera, our EBC correspondent there in Thailand, reports. Cristel?
Prime Minister General Prayut Chan-o-cha has declared a nationwide state of emergency, and initial restrictions have been issued in the fight against the COVID-19. In his explanation about the state of emergency and restrictions, Deputy Prime Minister Wisanu Kriangam said that the state of emergency to be in effect from 26 March to April 30 would enable the government to impose more legal and stringent measures to effectively control the virus situation. Under the state of emergency, people are prohibited from entering areas and places at risk of COVID-19 infection. Provincial governors and the Bangkok governor are empowered to close locations where many people gather for various activities. Access points to the country by aircraft, boats, cars, or other vehicles will be closed. Members of diplomatic corporations and international organizations operating in Thailand and their families who need to return to Thailand from overseas will be allowed, but they need to have fit-to-fly health certificates. Thai nationals overseas wanting to return to Thailand will also have to follow the same requirements. Relevant officials will ensure that there will be no shortages of necessary items and consumer goods, and hoarding of consumer products is forbidden. Gatherings of many people are also banned. Dissemination of fake news and information on COVID-19 through various media channels is forbidden, as it may cause panic among the public. 3 particular groups of people should stay at home to protect themselves from the possible virus infection outside. These vulnerable groups include people who are older than 70 years, children aged below 5 years, and people with some diseases such as diabetes, hypertension, stroke, and cardiopathy, respiratory problems, and allergies. The Ministry of Public Health on March 26 reported 111 new COVID-19 cases in Thailand, raising the number of confirmed cases to 1,045. Now, Alma, there are also 357 checkpoints monitoring travelers nationwide. The Royal Thai Armed Forces Command has set up 7 checkpoints in Bangkok and 350 more in other provinces to check interprovincial travelers and help contain the coronavirus disease 2019. The announcement said the checkpoints were in response to the Prime Minister tasking the command with supervising security measures relating to the COVID-19 pandemic. The checkpoints are being manned by soldiers, police, and civil servants who check travelers for symptoms of COVID-19 and behavior leading to risk of COVID-19 transmission, the announcement said. Measures will be implemented only when it is necessary to minimize the impact on the everyday life, it said. In Bangkok, the checkpoints were on Cheng Watana Road near Klong Prapa Canal, Suwin Tawong Road, Kanchanakisek 39 Frontage Road, Sukhumvit Road at the BTS Bering Station, Ratchapurak Road in Talingchuan District, Suksawa Road under Bumibol Bridge, and Rama 2 Soy 92 Road. Now, also, bus ticket sales suspended until April 30. Ticket sales for all public transport buses will be suspended from March 26 or today to April 30 in compliance with the government's declaration of a state emergency, which takes effect on today, the President of Transportation, Jirasak Yauvat Sakpo said. Ticket sales for all public transport buses will be suspended from today to April 30. And he added that the company will also enforce social distancing by leaving empty alternate seats on the buses and keep a distance of at least 1 meter between persons at all bus terminals. After the state of emergency was announced on Tuesday, March 24, people rushed to buy bus tickets. All tickets have been sold out beyond April 30. We cannot provide additional buses, and all available buses have been used. Complying with the social distancing policy halves the number of passengers per bus, added Jirasak. Those who haven't reserved tickets should refrain from coming down to bus terminals, hoping to get one since all ticket booths will be closed until April 30, he said. Those who had bought tickets earlier can still travel as per schedule. You can also postpone or cancel your trip and apply for refund as per the conditions of transport companies. DIRSEC added that some operators of private buses and vans have submitted appeals to suspend their service during the state of emergency. If you have already bought tickets from these operators, please contact them directly to ask for refund or postponement of your trip. Thank you, Alma.
Christelle, yes, before I let you go, just want to ask, because I saw some pictures earlier, some drive-through testing. They have this also in South Korea. Do you also have this over there? Drive-through testing of the coronavirus?
Yes, we do. A new drive-through testing center for the COVID-19 virus opened at Vibhawadi Hospital in Bangkok's Chatuchak district. Now, Vibhawadi Medical Center, just like in South Korea, has arranged for people to be tested without leaving their vehicles, a safe distancing approach already in use in several other countries. The drive-through COVID-19 test is available at Building 4 of Vibhawadi Hospital, where customers can arrive in their personal vehicles and get tested through the windows. Staff will collect samples from the nasal cavity and throat, which will be sent to the lab immediately. They will notify the subject of the results via SMS within 24 hours, so there's no need to go back to the hospital again to find out. The test costs around 6,500 baht, and the service is available daily from 8 a.m. to 6 p.m. The hospital's lab can handle 150 to 200 tests per day. Actually, Alma, about 50 people have driven in for a test in the first 24 hours.
All right, thank you very much, Christelle, and do take care. Keep safe over there, and we'll wait for more updates over there in Thailand. Thank you for your time.
Thank you. Updates of COVID-19 here in Bangkok, Thailand. I am Krista Ferreira. We live in interesting times.
Okay, let's go over to Vietnam. Health Ministry there warned residents to stay home as the cases of the COVID-19 reached 148. We have more update. Joining us live is Chriselle Lacuna from our EBC Vietnam Bureau. Chriselle.
Good afternoon, Alma.
How are you?
And to all the people watching. Good, good. Same as before. We're being very cautious this trying times. Okay, so here's the latest news from Ho Chi Minh City, Vietnam. Vietnam Health Ministry warns residents against going out as COVID-19 cases reach 148. The Ministry of Health advises residents not to leave their home as the country has confirmed 148 novel coronavirus diseases, with 7 added early this Thursday morning. People should not go out when not really necessary, and those over 60 years old should absolutely stay home, the ministry said. Residents are required to inform local authorities and police officers of arrivals, both local and foreign, to Vietnam from March 3 who have not been quarantined, it added. Local administrations must strictly enforce the closure of entertainment and amusement places, heavily fine offenders, the ministry said. Vietnam has recorded 14 new COVID-19 patients over the last 24 hours. 10 of them were isolated upon entry into the country from abroad, while one doctor caught the virus when treating an infected patient in Hanoi, the ministry said in a statement on Thursday. These 11 newly confirmed patients pose no risk of community spread. The other 3 have spent some time in the community. Vietnam has announced 148 patients so far, with 17 having been discharged from the hospital by Friday last week. No fatality has been reported as yet. Over 24 patients have tested negative for the virus, but they are still treated in the hospital, waiting to be discharged, according to the health ministry. The Vietnamese government has said the next 2 weeks is vital to its efforts to curb the COVID-19 epidemic, with resources to be focused on detecting cases early, isolating them in their contacts, limiting cross-infection, and managing to treat patients. Vietnam now requires all arrivals to be isolated in collective quarantine camps for 14 days, the advised incubation period for the virus. The country has barred entry to all foreigners and demands all entrants declare their health status. Passengers are required to fill out health declaration forms when traveling on long-haul buses, trains, tourist boats, and domestic flights. The Southeast Asian country has quarantined 44,955 infected patients, close contacts, and arrivals from epidemic-hammered regions as Thursday morning, according to the Ministry of Health's latest statistics. Health workers have tested 30,548 people to date, with 30,400 samples returning negative. Let's go to the northern part of Vietnam. Hanoi shuts down all non-essential businesses. All businesses except for essential services in Hanoi must be closed as the Vietnamese capital city ramps up its battle against the novel corona disease epidemic. The shutdown was ordered by Hanoi Chairman Win Doc Chung, pursuant to an announcement of the government office on Tuesday and based on the ongoing development of the disease. As Chung asked department directors and district leaders not to lower their guard down, all essential businesses, including karaoke parlors, massage services, bars, discos, video game centers, cinemas, stadiums, and crowded sporting activities were ordered to close down. Only business providing products classified as essential by the city, like food, gas, necessities for daily life, will be allowed to remain open. The city also restricts large gatherings at such occasions as weddings, death anniversaries, birthday parties, and meetings, while local people are encouraged to stay home and work and study remotely through the internet and television. Religious, faith, and places of worship are also barred from organizing activities drawing large crowds of people. Earlier, Chung told only bars, karaoke lounges, and several tourist sites in the capital to close through March 31. The new order added a number of other services to the scope of the ban. The Vietnamese capital is the largest locality in Vietnam to follow in the footsteps of Ho Chi Minh City, which has shuttered all entertainment and amusement centers, restaurants, beer clubs, bars, with a capacity of 30 customers or more from Tuesday evening. The mass closures in the southern metropolis will last until end of March. In line with this, going back to Ho Chi Minh City, a COVID-19 patient went to Saigon Mosque over 60 times before diagnosis. A patient of the novel coronavirus disease in Ho Chi Minh City had been to a local mosque for prayers 5 times a day, adding up to over 60 times in total between his return to Vietnam from Malaysia and his diagnosis, raising questions on how competent authorities could have missed such a serious case. Patient number 100, a 55-year-old man residing in District 8, previously traveled from Malaysia to Vietnam aboard the AirAsia flight AK524 on March 3. Between March 4 and 17, the man attended religious services 5 times a day at Hamul Anwar Mosque in District 8 in Ho Chi Minh City. District 8's medical center sampled him on March 18, although he showed no symptoms, as the man was found to have joined a crowded mosque event in Kuala Lumpur during his Malaysia trip. His result came back positive for the novel coronavirus on Sunday. There had been no direction from higher authorities telling us to search for the attendees of Malaysia religious event prior to March 16. The Islamic community of Ho Chi Minh City stated it was the Government Committee of Religious Affairs on March 12 to identify all people in the southern metropolis who had participated in the event in Malaysia. Tracking the attendees was quite a difficult task, as most of them traveled individually, the Islamic community remarked. From March 21, all incoming travelers to Vietnam would be isolated for 14 days as part of more assertive measures to curb the epidemic. Alma?
Tushel, have curfews been implemented there, just like here in the Philippines?
Yes, they've been mentioning it a few weeks back that there will be curfews, but later on the government decided to close down all establishments with more than 30 people.
Okay. What about food supply? Are your supermarkets well supplied, well stocked? How is it going over there?
So far, there is no panic buying going on right in here because they're very convinced they are the supplier among the Southeast Asian countries. So there's no panic buying so far, but they're very strict as to wearing of the mask.
Oh, okay. Thank you very much, Kushel, for your update, and we'll be waiting for more news from your country as we follow this developing story. Thank you.
Thank you, Alma. Reporting from Ho Chi Minh City, Vietnam. This is Kushel Yapuna. We live in interesting times.
All right, let's head on over to New Zealand. It is the first day of lockdown. Let's hear more from Greg Bessa. Greg?
Good day, Alma, and to all our televiewers worldwide. As you mentioned, today marks the first day of the lockdown, wherein the general public is required to stay at home and refrain from doing any non-essential travels. Those that are not classified as essential services are required to shut down their respective operations. And those who are classified or considered as essential workers, they are only the ones who are required to go to the respective offices or companies. Now, as of today, there are about 283 cases now, 78 of which are new cases over the last 24 hours. From these 283, 262 are confirmed cases, whereas only 21 are considered as probable cases. From those confirmed cases, 27 have recovered, which is 10% of the 10% of those confirmed cases, and then 7 of which are cases still in the hospital. So far, there is no recorded casualty or death from the COVID-19. Through its economic stimulus package, the New Zealand government is trying its best to help all businesses to continue their operations and to help all workers to keep their respective jobs. But realistically, the New Zealand government said that they could not save every business or every job here in New Zealand.
All right. Greg, I can see the pictures. It's like a ghost town over there. How is the city holding up with this first day of lockdown, do you think?
Yeah, when I took the photos and videos, it was around 8:30, and during normal days, it should be packed with people going to their respective jobs. But today, as I already mentioned, that it's the first day of lockdown, it looks like a ghost city because the government is very strict on the implementation of the directive that people who are not doing essential jobs should stay at home.
And it seems like the population is very obedient to the guidelines that the government has set, right?
Yeah. Generally, the people here in New Zealand are very obedient to the government's directive. They have always to follow. Otherwise, they have to face the consequences because the government has empowered the police and the military to enforce the restriction of the travel. If they could caught people, roaming around, flouting the directive of the government of staying at home, then they have the power to apprehend them and penalize them of a certain amount of New Zealand dollars.
Oh, okay. No wonder they're so obedient. What other measures has your government undertaken to lessen the spread of the virus over there? aside from the, yeah, go ahead.
Yeah, in terms of domestic travel, the government has only allowed the travel to up the midnight of Friday. Then after that time, then there will be no air travels unless the travel is required for the people who are doing essential jobs to roam around the country. And of course also to maintain the transport of logistics, especially in the food supply chain. And then the government also is encouraging New Zealand people who are still abroad not to, because the flights, many international flights have already been canceled. So the New Zealand government is just telling them to stay where they are right now instead of coming back or trying to come back to the country. Well, of course, the government also is preparing a special facility wherein those arriving New Zealanders who have symptoms should be directly put or immediately put into the quarantine in that designated facility.
Are there a lot of facilities that is being prepared?
Yeah, of course there are. Especially every hospital has their own designated, isolation rooms or facilities. So it's nationwide because the government, as they said, as they're using the model, they're expecting thousands more to be confirmed of the COVID-19 cases. Actually, they're using a kind of model we're in. It says if there will be no lockdown, about 80,000 New Zealanders will die from COVID-19. So that's why as early as possible, they're doing the lockdown, and it will last for the next 4 weeks. And then after 4 weeks, the government will review it. If there's a need to extend the lockdown, then they will do it.
So we were talking about facilities and hospitals, and the big worry right now are our frontliners, the health workers. How is your government taking care of your frontliners or the health workers?
Yeah, the government is urging the frontliners to follow the guidelines and protecting themselves. The Minister of Health is issuing guidelines for them in order to protect them from being infected with the COVID-19 while taking care of the patients. So they are strictly also following those guidelines for their own good as well.
What about protective equipment, suits and everything like that? Are they being provided also?
Yeah, of course, the government has provided everything. And the government is very, very aggressive in dealing with the situation right now, not only in containing or slowing down the COVID-19 here in New Zealand, but as well as protecting the people who are dealing with the patients being infected with COVID-19. So the government is urging each and every one of those living in New Zealand to do its part, to do his or her part, so that we can fight together in defeating the COVID-19 here in New Zealand.
All right, thank you very much for your update, Greg. And please keep safe. Do take care.
Thank you very much. This is Greg Bessa reporting for New Zealand Eagle News, for Eagle News New Zealand Bureau. We live in interesting times.
All right, let's go over to California. Our EBC correspondent in the Silicon Valley area, or in the Bay Area, Don Orozco, is joining us live. Don?
Good afternoon, Alma.
Good afternoon.
Good evening for those who live in California. It's about 11:42 right now in the evening here in California. And we have, I actually have with me some breaking news.
Okay.
And the breaking news is that the Speaker of the House, Speaker Nancy Pelosi of San Francisco, have decided to support the $2 trillion stimulus package that was presented in the Senate today, which was unanimously approved. And apparently Nancy Pelosi was telling everyone to just recognize the good of the stimulus package and let it just go so that the American public will actually benefit from it. Alma, the 2 trillion coronavirus stimulus package
Yes.
has the following, in terms of numbers.
Okay.
130 billion will be intended for hospitals. 150 billion for state and local government. 300 billion for small businesses. And then 4 months of unemployment insurance. You know how it is here in the U.S., if you do not work, there is an unemployment claim, which means you are even still being paid by the government on the days that you do not work. And then finally, they are providing a one-time 1,200 package for adults and 500 for every child. Kaya it is imperative for all Americans to register in the national census so that you will be a part of the stimulus package.
Okay, so if you're not registered, you won't get anything, right?
Yes, exactly.
Okay.
So that's why we call on all law-abiding citizens dito sa US to register and be counted, and you will get all the benefits out of it.
Okay.
Going to
what about the Bay
COVID-19.
Area? What's going on? Okay. Continue, please.
So on COVID-19, there is a spike, and this is probably the reason why Pelosi is now supportive of the measure, is because of the spike nationally on the numbers of tested positive here in the whole United States. There were about 20,499, Alma, that has been added to the numbers. It is now 451,355. That is why the fear that the center of COVID-19 might move to the U.S. is upon us because of the numbers that are really growing, That is why lockdown has always been implemented, and people are already asking to do the lockdown all over the United States.
How many states are in lockdown right now, Don? Do you know?
I do not have the exact number right now,
Okay.
but there are states like, for example, Florida. The governor there refuses to do a lockdown still, So I still do not know how many are really, but we'll get into that when I come back on my next report.
Which
But here
state
in
has the most
California-
number? Do you know? Which state has the most number of cases?
It is New York.
Okay.
New York remains to be the most number
epicenter.
of tested positive. Here in California, there is also spike. But again, because of the shelter-in-place, lockdown, or stay-at-home policy that was instituted by Governor Gavin Newsom, the testings has actually gone down, but still the numbers are still a little bit up because it is now a total of 60,115. It is there is an added 809 from the numbers that I am actually presenting to you, and then. Here in the let me just go to my notes. Here in the Silicon Valley, it has remained to be the number one in ang Silicon Valley has remained to be the number one most affected. Itong Santa Clara County. There is about 160 in San Mateo County, and then in Daly City. And then in San Francisco, there's 151. And then Santa Clara, it's 359. And then Alameda County, where Oakland and Hayward is there.
Yes.
It's 133. And then more or less that's the number that has been projected to us so far. So, yan ang kaganapan dito sa California. And then, the good thing is that Pelosi, which means the Democrats, are now supportive of the stimulus package that has been presented by the Senate to President Donald Trump.
All right.
And that's about it. And that's the latest dito sa entire Silicon Valley Bay area. This is Don Orozco, and we live in interesting times.
Thank you, Don. Keep safe. Take care. Meanwhile, the total number of confirmed cases in Australia is now 2,676. Let's confirm that with our EBC correspondent there, Diego Madroño. Diego, good afternoon here.
Good afternoon, Alma. Here are our latest updates on the COVID-19 situation here in Australia. As of 12 p.m. today, the total number of confirmed cases here in Australia is 2,676, with a jump of around 200 new confirmed cases. The death toll has also increased from 8 to 11, with 2 recent deaths occurring in Victoria. The highest number of infected is still in New South Wales with 1,029. However, both Victoria and Queensland have had an increase. Victoria rose from 411 to 466, so an increase by 55 new confirmed cases. And Queensland rose from 397 to 443, with an increase of 46 new cases. On a lighter note, we now have 118 recovered cases. Yesterday night, the Stage 2 lockdown measures were enacted, and these included the addition of at-home social gatherings, auctions, and open house inspections to the list of banned activities. Non-essential retail services such as beauty salons, play areas, and more have also been targeted and shut down. Discussions are already taking place in regards to Stage 3 lockdown measures and further strategies we can implement to flatten the curve of COVID-19 cases. Among the considered solutions are the shutting down of bookstores, electrical retailers, hairdressers, and indoor and outdoor markets, which are strategies that the UK has also implemented. So far, our current situation concerning these businesses are still quite lenient, with barber shops remaining open for strictly 30-minute long appointments, as long as the 1 person per 4 square meter restriction is observed. Here in Queensland, schools will begin to go into lockdown and observe pupil-free learning, so online learning portals will be put in place to allow school children to continue to learn from home. Despite this change being implemented on Monday, many students and parents have taken a proactive approach and have already begun to take their kids out of school early. This is common practice, as many people have already begun to self-isolate in their own homes after bulk buying, despite there not being an official lockdown announced. The government has advised that it is best to quarantine yourself to minimize the spread of the virus. One major dilemma facing many people here in Australia involves the continued surge in job losses. Travel agent Flight Centre has been forced to stand down 6,000 people, including 3,800 Australian staff members. As of 10 o'clock today, an additional 15,000 people have been removed from work due to the COVID-19 situation. Stores will remain closed until the 22nd of April. That's all for now, Alma.
Diego, you said a lot of people are out of work. So what happens to workers who are now laid off? What is the government going to do about this? Do you know? Do you have an update on that?
Yeah, so many of the workers or local business people are flocking to Centrelink in order to receive their compensation or payment. So far, the situation is still unclear whether or not people will be going back to work. So I will be back with further updates on that situation.
All right, thank you very much, Diego. And we'll be waiting for more updates from Australia. Keep safe, take care.
Thank you. This is Diego Madroño from Gold Coast, Australia. We live in interesting times.
All right, congressional lawmakers, as earlier reported, passed the $2 trillion stimulus bill to respond to the coronavirus pandemic. We have more updates on that from MJ Racadio. MJ is joining us live from California. MJ, how are you?
Hi, Alma.
Hi.
Hi. Well, as of March 24, 2020, 2 p.m. Pacific Daylight Time, there are a total of 2,535 positive cases of coronavirus or COVID-19 and 53 deaths, including one non-California resident. And for Los Angeles County, there have been 799 confirmed cases, 13 deaths as of 12 p.m. March 25th. And here in Sacramento County has 113 confirmed COVID-19 cases and 5 deaths. So far here in California, it's about 1 week now from lockdown. And I went out a while ago, and everyone is maintaining social distancing, meaning everyone in the grocery store, they put like a mark 6 feet in between per person to basically following the order of the governor here in California. And as I told you, there is a good news to this because let me just add to the report of Don Orozco that this is the 2 trillion package, the largest in U.S. history. So let me just elaborate a little bit. You can get those payments as long as you filed income taxes back 2018. So that is the requirement. So you could get those, but there is a catch to that. Okay, let me just tell you, direct payments of $1,200 to most individuals making up to $75,000. Or $2,400 for couples making up to $150. So each dependent child increases amount of additional $500, and the amount increases for individual with incomes about $75,000, and payment cut off for those above $99,000. So if you're making more than that, you don't get anything at all. And then expanded unemployment benefits that boost the maximum benefit by $600 per week and provides laid-off workers their full pay for 4 months. So eligibility is extended to independent contractors and self-employed as well. So let me just give you some more numbers here. $367 billion in loans for small businesses, $150 billion for state and local governments, $130 billion for hospitals, $500 billion in loans for larger industries, including $25 billion for passenger airlines, $4 billion for carriers, $3 billion for aviation, contractors, and $17 billion for businesses critical to maintaining national security. So in addition to that, there's some performing arts over here, $25 million for John F. Kennedy Center for Performing Arts, and $400 million for election security grants. So let me just read to you, according to Minority Leader Chuck Schumer, who engaged in intense negotiations with Treasury Secretary Stephen Mnuchin, said the bipartisan agreement comes after 5 days of arduous negotiations, after sleep-deprived nights and marathon negotiating sessions. So the deal, McConnell said, will rush new resources onto the front lines of our nation's historic fight, and it will inject trillions of dollars of cash into the economy as fast as possible to help American workers, families, small businesses, and industries make it through this disruption and emerge on the other side ready to soar, he said. Well, let's go to the, that is really good news to all the Americans, especially the Californians. As of today, there's about millions of Californians filed for unemployment. So that is unprecedented. So let's go into the lighter note. Emmy Award-winning host Rosie O'Donnell, Rosie to the rescue, a special one-night-only return on the Rosie O'Donnell Show and bringing together some of the biggest names in entertainment live from their home. So this thing to benefit the Actors Fund in order to provide aid during the coronavirus outbreak. And more details about that, go to Broadway.com. And are you a big fan of Angry Birds? So this is your chance to see it. It'll go to Netflix this 2021.
All right. Thank you so much. Thank you for that little bit of showbiz news for us.
Definitely. And this is FJ Racalia reporting from Sacramento. We live in interesting times.
Thanks. Take care, MJ. Let's go to American Samoa. Earlier, we reported that 6 test results for COVID-19 had come back negative. And we'll see if that is still true from Arian Torres, our EBC correspondent there. Arian?
Hi, Alma. Good afternoon there in the Philippines. And good evening in Talofa here in American Samoa. Yes, as with the result, it's negative. And here in American Samoa, still a good news that there is no reported case of COVID-19. Alma.
Okay. So, okay, that's good. That's good. Can we play now that interview from your student, that student you interviewed earlier?
Yes. Yeah, let's listen in with one of the student here in, one of the student from the private school here in American Samoa.
Okay.
As a student during this time of a severe pandemic, I am now currently required to stay home for 30 days. During this time period, I will utilize my time to solely focus on my academics. My school has provided an online class that is able to provide the academic needs of the students. Through this platform, I am able to continue my studies and at the same time protect myself from the virus. Though there are a couple of setbacks from this online method, it is a big help to each student, including myself, to have a flexible schedule and a comfortable learning environment.
Positive. Thank you. Thank you, Arian.
Just additional with that one, that American Samoa, the Department of Education will provide lunch and breakfast and lunch for all the students here in the island. So we'll make the full report of that Eagle News International later.
All right, we'll wait for that. We're always waiting for your updates because you're always positive, and I sure hope they remain to be. Thank you so much, Arian, and you do take care over there.
Thank you, Alma. This is Arian Torres, Eagle News. We live in interesting time.
Thank you, Arian, and that is our news for today. I'm Alma Angeles, and indeed, we live in interesting times. Take care.